Good morning, everybody, and ohayo gozaimasu. Today I will have a small speech about the link between the liver and the lungs, or what we call the liver-lung link, or the hepatopulmonary relationship, the relationship between the lung and the liver in disease. That is, diseases of the liver causing pulmonary manifestations, or diseases of the lungs causing hepatic manifestations. Of course, the whole human body is always working in harmony, whether in health or in disease, and the organs and the systems of the human body are inseparable, or cannot work in a divided or separable manner. And any problem in any organ or system in the human body will affect the other organs or systems directly or indirectly. This is a rule, because this is a body. It's not, we are treating a body, and the doctor should, the clinician should know this, because the physician is managing a human body. He is not managing a single organ or a system. No, he should know that he is managing a body, and the different organs and systems, they are working together, and they are interrelated, and any problem in one organ can affect the other organs, and any disease in one system can involve and affect the other systems. As an example of this is my talk today about the link between the liver and the lung, or the cardiopulmonary circuit as a whole, because you know that the heart and the lung, it's a circuit. But let me focus more on the relationship between the lungs and the liver in disease. How can the lung diseases affect the liver, and how can the liver diseases affect the lung? The relationship between the two organs in disease, the lung and the liver in disease, is one of three things: either a disease starting in the liver and then affecting the lung, or a disease affecting in the lung and then secondarily involve the liver, or will affect the liver, or a disease which affect both the liver and lung simultaneously or concomitantly, what we call simultaneous involvement of the lung and the liver by some pathology or some one disease. This is concomitant involvement of the lung and liver in disease. So it's either starting in the lung with secondary hepatic involvement, or in the liver with secondary pulmonary involvement, or and both together at the same time. Let me give you examples of, I will just give all of you examples of the three cases. Diseases in the lung which affect the liver, for example, is the most common, is obstructive pulmonary disease. Obstructive pulmonary disease, as COPD, which involves two big categories, emphysema and chronic bronchitis. They might be complicated by cardiac affection, and this is called cor pulmonale, that is heart-lung disease. And then when the right side of the heart is affected by the COPD due to pulmonary hypertension, that is, there is right-sided enlargement with or without failure secondary to COPD, then later on we get right-sided heart failure, and then as a result of the right-sided heart failure there will be, of course, what we call congestive hepatomegaly with enlarged tender pulsating liver in advanced cases. So cor pulmonale complicating COPD, which is obstructive lung disease. This is an irreversible obstructive lung disease, COPD, complicated by cor pulmonale, and cor pulmonale complicated by liver congestion and what we call congestive hepatopathy, or congestive liver disease with enlarged tender pulsating liver. This is a one form, and it's a common example of liver involvement or liver pathology secondary to lung disease, COPD. Another example is the simultaneous involvement of the liver and the lung in another form of COPD, but due to hereditary disease or a genetic problem, which is alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency, of course, will cause some sort of congenital emphysema, and at the same time it causes a form of hepatopathy or hepatitis due to alpha-1 antitrypsin deficiency. So alpha-1 antitrypsin deficiency is a genetic disease which involves both the lung and the liver. It can start in the lung at first. The presentation may be the lung and then the liver will appear later, or the reverse. It might start as a form of hepatitis, acute and then chronic, which will manifest later in the lung with a congenital emphysema. Or they might present with both features of pulmonary and liver involvement at the same, almost the same time. So alpha-1 antitrypsin deficiency will put the liver and the lungs in the picture together. Alpha-1 antitrypsin deficiency with hepatic and pulmonary manifestations. Another third example is lung cancer with hepatic metastasis. Also, this is another form of lung disease starting the lung with secondary hepatic involvement, the secondary involvement of the liver. So lung cancer with spread to the liver, metastatic lung disease, metastatic lung cancer with hepatic metastasis or liver metastasis. That's another example. So this is the one form of lung disease with hepatic complications or with liver manifestations later on. Then we come to the other example is liver disease, which is then complicated by lung or pulmonary involvement or pulmonary manifestations or pulmonary complications in liver disease. The commonest example is autoimmune liver disease, for example. Autoimmune liver disease, and the most common varieties of autoimmune liver disease are the autoimmune hepatitis and primary biliary cirrhosis and primary sclerosing cholangitis. These three autoimmune liver disease categories can be associated or complicated with or associated with interstitial lung disease, and this is some sort of involvement of the pulmonary interstitium, and there will be interstitial lung disease complicating the autoimmune liver disease. In fact, there may be involvement of the parenchyma, there may be involvement of the blood vessels also, later on with pulmonary hypertension. There may be involvement of the pleura even, there may be involvement of the mediastinal lymph nodes in such cases. So involvement of the mediastinum, the pleura, the lung parenchyma and the lung vessels may be secondary to an autoimmune liver disease. But the most common form of lung pathology in autoimmune liver disease is interstitial. This can be exemplified or put collectively as ILD or interstitial lung disease in patients with autoimmune liver disease. At some stage in the course of autoimmune liver disease, lung manifestations will appear, and the role of the physician is early detection and treatment of lung disease or pulmonary involvement in patients with autoimmune liver disease by doing, for example, screening HR or high resolution CT scan of the lungs, that is HR-CT lung scans, to detect the pathology in the blood vessels, in the interstitium, in the parenchyma, in the pleura, and even in the mediastinum in patients with autoimmune liver disease. As I mentioned, in chronic autoimmune hepatitis, in primary biliary cirrhosis, and in primary sclerosing cholangitis. Another example of liver disease complicated by lung disease is, for example, amoebic liver abscess, which ruptures into the pleura, causing pleural effusion, and it may even rupture into the lower lobe of the lung, causing amoebic lung abscess. So another example, this is a parasitic abscess inside the liver caused by Entamoeba histolytica, what we call amoebic lung abscess. Of course, the liver and the lung can also be involved by other parasitic cysts like hydatid disease involving the lung and the liver at the same time. This is a historic common example of parasitic infectious pathology involving both the liver and lung. Of course, there are many other infections which can simultaneously involve the lung and the liver. For example, the most common are tuberculosis and brucellosis and histoplasmosis and Q fever. They involve both the lungs and the liver simultaneously. Also, the famous Legionnaire's disease of the lung, which is one of the causes of atypical pneumonia, can cause hepatic abnormalities, and the simplest form is abnormal liver function tests in patients with Legionnaire's disease or Legionella pneumonia infection. So in some pneumonias we get hepatic involvement, whether asymptomatic with just biochemical changes expressing themselves as abnormal liver function tests, or as asymptomatic liver pathology due to direct involvement of the liver by the organism. So either it is subclinical or clinical, it varies from case to case, but there is a pathological involvement of the liver with subclinical or clinical manifestations as a result of lung infection in patients with Legionnaire's disease or Legionella pneumonia infection. So this is also another example of involvement of the lung in infections by an infectious pathology. And I gave examples, maybe acute infections like Legionella or chronic infections like brucellosis and tuberculosis involving both the lungs and the liver. So this is another example of liver and the lung. So the liver in autoimmune disease, in amoebic hepatitis, etc. Also, the liver and the lung can be involved simultaneously in some granulomatous or bigranulomatous diseases, like in patients with sarcoidosis. So sarcoid lung disease or pulmonary sarcoidosis, they may also be complicated by a granuloma or sarcoid granulomas in the liver, and they might present together at the same time, or they might present in sequence. That is, the sarcoid start in the lung, and then later on the sarcoid will manifest in the liver as a hepatic sarcoidosis or liver sarcoid disease, which is a granulomatous disease of the liver. So these are examples. Also, another example of this starting in the liver and then causing pulmonary manifestations is liver cancer with metastatic spread to the lungs, that is with lung metastasis or with pulmonary metastasis, whether solitary or multiple metastasis in the lungs, complicating hepatocellular carcinoma. So here is a disease starting in the liver and then later on will secondly involve the lung or will manifest in the lung. So hepatic cancer presenting with lung metastasis. Same I mentioned before, lung cancer with hepatic metastasis. So we should put this into consideration. So this is as a neoplastic pathology. So I mentioned examples of infectious causes, I mentioned the examples of neoplastic causes, of inflammatory causes, of genetic causes like alpha-1 antitrypsin deficiency, of autoimmune causes like, as I mentioned, patients with autoimmune liver disease complicated by interstitial lung disease. Also, patients with autoimmune lung disease, most common is rheumatoid, Sjögren, or progressive stem sclerosis involving the lungs, and they might later on involve also or present with some sort of inflammatory liver disease. So here in autoimmune lung disease with hepatic involvement or autoimmune liver disease with lung involvement. At last, we have to mention two important syndromes which are related to the lung in patients with chronic liver disease, and these are what we call hepatopulmonary syndrome, and the other one is the portopulmonary hypertension. And for these two specific clinical categories, the hepatopulmonary syndrome and the portopulmonary hypertension, I will have special mini presentation later on. But I have to mention them because they also are examples of the liver-lung link. What is the hepatopulmonary syndrome and what is the portopulmonary hypertension? This is the topic of my next presentation as a continuation of this one. Thank you so much. Have a good day.